Assalamu alaikum, dear viewers. Welcome to Nursing Lecture with Imtiaz. Dear viewer, in today's lecture, we will talk about the meaning of randomized control trial study. First of all, we should know about the definition of randomized control trial. It is a study in which subjects are allocated at random to receive one of the several clinical intervention. One of these intervention is the standard of comparison or control. The control may be a standard practice, a placebo, or no intervention at all. In other words, RCT are a quantitative study, comparative and control experiment in which a group of investigators study two or more intervention in a series of participants allocated randomly to each intervention group. Now, the qualities of randomized controls study. Experiment. Investigator can influence number, types, and rhythm of intervention. Quantitative. Measure events rather than interrupt them in a natural setting. Comparative. Compare two or more intervention, or intervention is compared with a placebo or no intervention. And the third most important thing which happen in the randomized control trial, that is randomization. Random allocation of subject to intervention group and the control group are also called comparison group, so that all participants have equal chance of being allocated to each intervention. The RCT is a random allocation of subject to intervention group, so that all participants have an equal chance of being allocated to each intervention group. These are the most straightforward of studies to design and interrupt. RCT are often considered to be the gold standard of clinical and epidemiological study. This is because if they are conducted properly, it is often possible to be fairly sure that the results are correct, at least for the types of patients who took part in the study. Now we will brief talking about the history of randomized control trial. The chronological of clinical trial can be assumed to date back to approximately 600 BC, when Daniel of Judges surprised what is perhaps the oldest record clinical trial. Comparison was made concerning the health effects of vegetarian diet with a royal Babylonian diet for a 10-day span. Credit for the modern randomization trial usually goes to Sir Aston Hale. Sir Aston Hale is known as the founder of modern founder of randomized control trial. The Medical Research Council trial on streptomycin for the treatment of pulmonary tuberculosis are considered landmark trial that ushered in a new era of medicine. Since that time, the randomized control trial procedure has been accepted to a greater degree, and there has been a significant growth in number of randomized control trials. Now, characteristics of randomized control trial. The main features of randomized control trial randomization, which is the most crucial step in RCT, is the randomization. The main purpose of this step is to stop selection based by distributing the feature of patient which might influence the result randomly between the group, so that any discrepancy in the result can be detailed only by the treatment. Randomization is an effective method to balance confounding factor between treatment group and eliminate the influence of confounding variable. It enables investigator to assess whether the intervention itself is opposed to other factors caused by the observer. From a well-defined point, time 0 or baseline for the study, each participant must follow till the end of point of study, except come as defined in the study.